Okay, so we're going to finish stuff up with variation in synovial joint structure and a couple different types of arthritis. This part's pretty easy. Hinge joints move like a hinge door, which move in one plane. They swing in and out, but they don't like move up and down or whatever, like a Star Trek door or something. But so, for example, on that one, there's lots of good ones, like pretty much the knee joint. If you look in your book, it'll talk about how there's a little bit of rotation in there, but let's go with that. For the most part, with the knee, so example, just write knee there, you get flexion and extension, and you don't really get any other movement. If you see a knee move in a way other than flexing and extending, something broke in there. Okay, so hinge joints move like a hinge on a door really well in one plane. Pivot joints allow for uniaxial rotation. Rotations, like, so for example, joint between C1 and C2. And remember, we just reviewed that last time. Who's that? Yep, Atlas. Who's that? Yep, Axis. Yeah, when you shake your head, no. All right, condyloid joints have condyles in them, which is a condyle is a rounded projection on one bone. It's going to fit into a concave surface on the other. And here I put the TMJ, which is the temporomandibular joint. Paste. If you want to write down. Temporomandibular joint. So the joint between the temporal bone and the mandible. But, if you guys don't remember these bone parts, go look at your bone list for part 1. So on the mandible, there's that rounded projection called the mandibular condyle. So that's a good name for a condyle in the mandible, right? And if you look at where it plugs into the temporal bone, there's a little dip there called the mandibular fossa. So there's your dip, there's your rounded projection. Together, there's your temporomandibular joint. All right, ball and socket joints. You got a ball and you got a socket. So for example, like the hip, you got the head of the femur and it fits into the acetabulum on the pelvis, or the shoulder. You got the head of the humerus and it fits into the glenoid cavity there. So pick one of those. All right, knee joint, like we just said, pretty much the movement allowed here is flexion and extension. All right, so flexion and extension. Note there's lateral and medial meniscus in there, and wait, hold on. I kind of don't remember what I'm doing. Oh, yeah, okay. So the lateral and medial meniscus between the femur and the tibia. So for the function there, just flip the page, and I'll find you guys a picture. Function. Cushions and stabilizes the joint. The menisci kind of conform to the shape of the bones, and it sort of helps hold them together. So, oh wait, here, that's going to do that and some other stuff. So hold on from that picture, and I'll show you a whole bunch of stuff at one time, because the next things are on there too. Okay, it also shows the ligaments, the extracapsular and the intracapsular ligaments. Extracapsular ligaments are on the outside of the joint capsule. Remember the tough outer covering. Intracapsular ligaments are on the inside of the joint capsule. So on the outside of the joint capsule, you got the lateral and medial collateral ligament, which are also known as this. Wait. Cut. Paste. The fibular and tibial collateral ligament. So the lateral is also known as the fibular collateral. The medial is also known as the tibial collateral. And I don't remember I'm sure your book calls it both in various places. If you look in the pictures of your book, guys, and what you should do in your book, look for there's a whole, 2 pages that are just pictures of the knee joint. Check that out. But anyway, they'll call them, I think they call them this on the pictures, fibular and tibial collateral ligaments. All right, so those guys are on the outside of the joint capsule. On the inside of the joint capsule, we got our intracapsulars. Here's the anterior and posterior cruciate ligament. The ACL is a really famous ligament because of these common sports injuries. It's common to get an ACL tear, and a lot of times people get meniscus tears. But one thing the ACL does is prevent. Got to type it here because I forgot to do it before. Hyperextension of the knee. So it helps prevent hyperextension of the knee. The knee should go to 180 degrees and not move any further. If you see a knee hyperextend, that ACL got tore. All right, guys. I don't know if this is going to be the only thing that's going to go on with this injury, but I guarantee one of the things that went down is he tore his ACL. So here, you watch this guy running with the football. Did you see it? Here, they'll do the slow mo here, I think. All right, watch him go down, and watch that knee there. Holy smokes! Knees ain't supposed to bend that way. Yeah, so that ACL got tore there. Yeah, and maybe who knows what else happened in there too. Okay, all that stuff's kind of injured. You guys don't really have to write anything there. And you get, just for the sake of time, we're going to kind of skip over this too. But damage to that stuff heals really slowly if you just really tear like an ACL. So probably maybe some of you guys know, if you ever had a torn ACL, it's just something you got to surgically fix sometimes. And a lot of times what they'll do, I've had a couple students that had an ACL replacement. We'll do a graft from the patellar ligament. It's usually what your doctor taps or you tap. If you do your little knee jerk reflex there, it's a little chunk of ligament that hooks your kneecap up with your tibia. So they'll take a strip out of that and make a new ACL out of it. All right, what are we writing? Arthroscopic surgery. Guys, an arthros joint, remember? And anything you got a scopic, you're using like an endoscopic tube to go in and fiber optic tube to go in and check out the joint. But with arthroscopic surgery, I'm just going to show you guys some pictures. So just show and tell. Just look. Oh, wait, here's that one picture I was going to show you guys before that shows all the knee stuff. This is the anterior view of the knee. Here's lateral and here's medial. There you can see the menisci. They're lateral and medial meniscus. We can see the collateral ligaments. So they're the lateral and medial collateral. So remember we said the lateral collateral is also called the fibular collateral because it attaches to the smaller bone, the fibula. Medial collateral is also called the tibial because it attaches to the tibia. Here you can see the ACL, the anterior. Guys, in a note, the reason they call the cruciate ligaments the cross ligaments. So note, is cruciate means cross. If I didn't say that, because they form an X in the middle of the joint. The anterior moves anteriorly, and the posterior moves posteriorly. Yeah, and they make an X right there. There's a really good picture in your book that shows it a little bit better than this, but. Remember, these guys are on the outside of the joint capsule. These two guys here are on the inside, and they've removed the joint capsule just so it's easier to see all the other stuff. All right, here's a guy that's had arthroscopic surgery. If any of you guys have had arthroscopic surgery on your knee, you've either got 2 or 3 scars probably from it, but that's where they stick in the tools. Which one is the arthroscope, the little viewer? One's like oh, that's over here, arthroscope, which is a camera and a light source. They got a little instrument which has got all sorts of little tools, shavers and pokers and scrapers and stuff you can stick in there. And this thing forces fluid through the joint, which kind of separates the joint, makes it easier to work on. I think it kind of flushes stuff out. So here's a video on YouTube of an arthroscopic surgery. I don't know how good this is going to be visible. This is what the doctor sees. See how it looks all hairy and stuff in there? That's bad. Stuff on the inside of a joint should be nice and smooth. And there's the tool. You can see it like spinning. That's like some type of shaving. Oh yeah, shaver. So he's got like a torn meniscus. So he's debriding it. He's taking off the loose chunks of stuff that's in there. Basket used to trim tissue. All right, he's just taking off loose chunks. So he's got a meniscus tear. Fast forward here a little bit. Where you can see there's like fluid in there. And then you'll see like bubbles go by. Oh, this is so he's going to put sutures in here. He's going to anchor that meniscus down. There you see. I'm skipping around a little bit, but all right, you get the idea. That's arthroscopic surgery. Okay. Sprain. If you sprain something, oh here I'll go. I had it typed out before, so I won't waste it. Boop. Stretched or partially torn ligaments. All right, and I forgot to write something here for. Okay, so a dislocation. It's not in its normal position anymore, but the fancy word is a luxation. Luxation. So if you see that, it means a dislocation. So go ahead and write that down. Maybe annotate. That's the medical word for it. But also, if you see the term subluxation, that's a partial dislocation. You get like a vertebrae sometimes. All right, a couple different types of arthritis. There's a bunch of different types of arthritis. We're going to hit at 3. for arth, joint, itis, inflammation. They're not all inflammatory, but like okay. So anyway, this one osteoarthritis. So they're osteo for bone, so it's going to involve bone. So sometimes they call it wear and tear arthritis. So just read it here. It says, it's age-related degeneration of the articular cartilages. So remember those. You guys don't remember the articular cartilages. Remember, it's a protective cap over the ends of the bones. And as we get older, it's not replaced as fast as it's worn out. So it says 85% of all people over the age of 70 have it, rare before 40. If you know a kid, like if there's someone that's young, that has arthritis, it's not this one probably. If you know someone older that does, but put your money on that. And I'll show you guys I'll show you a picture now. Here, I know it's kind of small, but here it's showing a healthy knee joint. There's the articular cartilage, that protective cap. You can see the ACL there, and there's the menisci. And then as we get, here it says eroded cartilage. As we get older, that just starts to wear away. And here's an X-ray. I think we looked at this one before, but here it says narrow joint space. Without the articular cartilage in there, the bones, that cap doesn't separate the bones as much, so you start to lose the bone space. And then you get the formation of these bony spurs in there. It's like just these bone outgrowths that form in the joint. Okay, so nothing to write there. We just show and tell and know what it says up there. All right, rheumatoid arthritis. This is an autoimmune disorder. Remember that means your own immune system is going to cause the problem. It's supposed to attack bad guys, and it makes a mistake and it attacks your own joints. First thing it attacks is the synovial membrane, the inner lining that produces the fluid. Here, who gets it? Well, anyone can get it. Commonly people, this might be worth writing down too. Commonly, I think people are probably in their 30s or so when they first get diagnosed. There's a version of it called juvenile rheumatoid arthritis, which people are younger. Say usually people are in 30s or 40s. Maybe add that. It says women more commonly than men. Guys do get it, but it's like, I forget the stat off the top of my head. It's at least twice as common in women. Most autoimmune diseases are for whatever reason, but yeah. And so more commonly in women, more commonly than men, and it usually begins like in your 30s. Another thing you might want to add here, guys, is kind of FYI, is frequently other organ systems are affected too. It's not just the joints. As this autoimmune thing goes on, like I knew a guy he's in class. He had rheumatoid arthritis, and he had to have a kidney transplant. It damaged his kidneys, and all sorts of other stuff. Hold that thought, and we'll do some pictures. Gout. With gout, you get. Yeah, let me just get the whole thing. Here's my other sheet. I'm copying and pasting from. Here's what you want right there. Excessive uric acid in the blood, and it crystallizes in the joints. Uric acid's a component of, it's kind of supposed to be in our urine. We don't have a lot of it, but it'll crystallize in our joints if we have too much of it. If you see bird poop, that white stuff in bird poop, that's uric acid. And remember that here in a minute when we check out a picture online. This one's more common in guys than in girls. So women can get gout too. We'll see pictures of women with a gout. All right, so let's check out some pictures. This is so here's a rheumatoid arthritis. This is just showing you, this is inflamed synovial membrane. Remember we said that was the first thing that was hit. And here you got all these like T lymphocytes and macrophages. It's showing that the components of the immune system are causing the problem. And this lady's got, you see these are called nodes. There's different names for the nodes at different locations, but as that inflammation progresses, it starts to eat away the bone and kind of dislodge them. So one thing you'll see with her besides the giant nodes, is her fingers are kind of poked off to the side. If you look at an X-ray, or short on time, so I'm going to go faster, you get something called ulnar deviation of those fingers. See how they're poking off away from the thumb? It just kind of pops them off the joint, and the immune system starts to tear up the bone in there too, so you get bone erosion and bone displacement. Here's gout. You see there's the red stuff going on. So if you open that joint up though, these are called tophi, these really big swollen areas. You see it's kind of white. If you open that up, remember we talked about bird poop? Here, this is like they're surgically kind of getting that stuff out. There are drugs that can treat this. You can scrape this out, but you got to get rid of the high uric acid levels. But there's that white pasty stuff that just fills up that joint, crystalline stuff. Yeah. All right, and that's it for Chapter 8. One more vid of the study guide.